Erectile dysfunction can be one of the most confusing and frustrating problems a man will ever face. You might ask yourself, is it all in my head or is something physically wrong with me? That question alone keeps many men awake at night. The truth is, erectile dysfunction can come from two very different directions. On one hand, it may be linked to stress, anxiety, depression, or relationship problems, factors that block the brain's ability to send the right signals. On the other hand, it can be caused by very real physical conditions, like heart disease, diabetes, low testosterone, or prostate problems. And in many cases, it's not just one or the other, it's both working together. That's why a urologist is the best doctor to help you figure it out. They have the training, the tools, and the experience to uncover whether ED is psychological, physical, or a combination, and to design the right treatment for you. In this video, we'll walk through exactly how they do it and why knowing the difference can completely change your outcome. When a urologist looks for physical causes of erectile dysfunction, they're asking one main question. Is there something wrong with the body's systems that control erections? And often the answer is yes. One of the most common culprits is cardiovascular disease. Erections rely on strong, steady blood flow. If the arteries are narrowed by high blood pressure, high cholesterol, or plaque buildup, the penis is often the first place you'll notice a problem, sometimes years before heart symptoms show up. Another big factor is diabetes. High blood sugar damages both blood vessels and nerves, making it harder for signals to travel and for blood to flow properly. That's why men with diabetes have a much higher risk of ED. Low testosterone is another physical cause. Without enough of this hormone, men often experience reduced sexual desire, low energy, and weaker erections. And then there's the prostate. Conditions like enlargement, prostatitis, or prostate cancer, and even the treatments for them can interfere with the nerves and circulation needed for erections. The key point is this: ED isn't always just in your head. It can be an early symptom of serious medical problems. That's why urologists always dig deeper to protect not only your performance, but also your long-term health. When a man comes to a urologist with erectile dysfunction, the first step is figuring out whether the cause is physical, psychological, or a mix of both. And that process is more straightforward than most people realize. It usually begins with a detailed medical history. The urologist will ask when the problem started, how often it happens, and in what situations. If erections are still strong during sleep or early in the morning, that can be a clue that the body is working fine and the cause may be psychological. If erections are consistently weak or absent in all settings, it points more toward a physical issue. Next comes the physical examination. The doctor checks blood pressure, weight, and signs of vascular disease. They may also perform a prostate exam to rule out enlargement or cancer. Then, lab tests are ordered. These can include blood sugar and cholesterol to assess diabetes and heart disease risk, as well as hormone testing, especially testosterone levels. In some cases, a PSA test is done to evaluate prostate health. If circulation is a concern, the urologist may order an ultrasound Doppler test to see how well blood flows into the penis. For men with diabetes or neurological symptoms, nerve function tests may be included. Finally, the urologist looks at lifestyle and emotional factors, stress, relationship health, sleep patterns, and mood. By combining all these clues, a urologist can usually pinpoint whether ED is primarily physical, psychological, or both. And that's the crucial step, because only with the right diagnosis can the right treatment begin. Knowing whether erectile dysfunction is caused by the body, the mind, or both is not just an academic question. It completely changes the way treatment works. If ED is primarily psychological, the best results often come from stress management, counseling, or sex therapy. Sometimes short-term use of ED medications can help break the cycle of performance anxiety, while therapy addresses the deeper mental or emotional barriers. If ED is due to physical causes, treatment must focus on the root problem. That could mean managing heart disease risk factors, improving blood sugar control in diabetes, balancing hormones with testosterone therapy, or treating prostate conditions. In these cases, medication or surgery may also be needed, but they're tailored to the specific condition. For many men, ED is a combination of both physical and psychological factors. For example, A man may have mild vascular disease but also struggle with performance anxiety. A urologist recognizes this overlap and builds a plan that addresses both sides of medical treatment plus mental health support. The bottom line, without knowing the cause, treatment is just guesswork. But when a urologist identifies the difference, therapy becomes precise, effective, and far more successful, restoring not just erections, but confidence and overall health. Men, erectile dysfunction can feel confusing, even overwhelming. You might wonder if it's stress, if it's yet your health, or if it's both. The truth is, you don't have to figure it out alone, and you shouldn't. A urologist is the doctor trained to connect the dots. They have the tools to test your blood, check your hormones, evaluate circulation, and examine your prostate, but they also understand the mental and emotional side of ED and can guide you toward counseling or therapy if that's part of the solution. The key is not to ignore the problem or cover it up with quick fixes. ED is your body sending a message, and the sooner you act, the sooner you'll know what's really happening and how to fix it. So take the next step, make an appointment, ask the questions, get the tests, because protecting your confidence, your health, and your future is worth far more than pretending nothing's wrong.